Phases of care.
Phases of care. Okay, thanks, Sam. We wanted to talk a little bit more about phases of care today. And obviously, when patients come in, they typically are in some kind of discomfort or have some type of unanswerable problem that seems to be beyond their control. And we just want to get them in and let them know that even though this is beyond their control, we can help out with this typically. If not, it's something we need to refer, we'll refer them out. But by and large, we see patients for pain syndromes, and we'll get them in and talk about reducing that pain. That's what we call our acute phase of care, and that's our first initial phase of care, and typically what most patients will identify chiropractic care with. So some of the common things, of course, are low back pain, neck pain, headaches, sciatica. They may have some kind of radiating pain or numbness in their arms, hands, carpal tunnel kind of things, So it's different neurological, myofascial, musculoskeletal conditions that we would deal with on a day-to-day basis. And we also do some other things that aren't as mainstream chiropractic, I guess, and that would include things like vertigo, or we've had people with chronic sore throats, chronic earaches for kids, and things like that. So even digestive disorders, that kind of stuff, So we don't mind taking a look at things and at least giving folks a trial of care if it's not something that is typically our mainstream day-to-day thing. So we don't like for folks to come in and feel like they've got an unanswerable problem. I like to at least give them some alternatives, even if it's not chiropractic care, something else they may be able to do, or another professional they may be able to seek out to get an answer to their problem. So there's very rarely an unanswerable problem. So with that said, I do want to expand a little bit about our acute phase of care. This is typically where patients come in and see us. We do an evaluation on the patient's condition, and we'll do a history and physical exam, and we also take x-rays, our diagnostic views in-house, and then we'll do an analysis of those and report that to the patient the next day. So we want to get a quick answer and a quick perspective for patients and some type of idea of what it's going to take to maybe get some of this pain decreased. Typically, I'll tell patients typically that, it is very typical for patients to receive care and decrease their pain level to half within the first 2 to 4 weeks of care. This is very, very typical, very, very common. We'd expect this in over 80% of our cases, so it's very reliable. It's not unusual, however, for patients to feel better after their first visit or their first 2 or 3 visits. So we, of course, get excited when people's symptoms are resolved in an accelerated way, but we want to give people a realistic perspective when we first get started as well. So that's some of the things people can expect in the first part of the care, and as we get symptoms under control consistently and we see some good resolution, we'll move into a more rehabilitative type of care to try to redevelop the existing capacity for function that they have, and then we'll even try to stretch that capacity to move beyond that in rehabilitative, maybe some structural work or something. So there's other things after pain management or pain resolution. And mentioning pain management, I do want to say that chiropractic is probably one of the best non-drug pain management out there. I've been doing non-drug pain management for 28 years, so that's basically what we do. Everybody's wanting to know what's the answer to the opioid crisis, so maybe we'll do a segment on that as well. Thanks.